Hi, my name's Kay and I'm a second year midwifery student at the University of Sheffield. Today we're at Sandfox House, which is where we practice our clinical skills before going out onto placement. So this morning we're going to be practicing basic life support. This involves learning CPR techniques and also the use of a defib in cardiac arrest situations. Having the clinical skills sessions is really beneficial. We can practice all the things that we're going to do out on placement, but in a safe, supportive environment with professionals that have got the experience to show us the gold standards that we need to learn to use out there in the hospitals and in the community settings. So it is really, really beneficial.
So I always knew that I wanted to do something medical. I was once looking at all the different roles and I came across midwifery and I just thought that is the one for me.
So I chose to be a midwife because I've had 3 children of my own, and throughout my pregnancies I was really interested in the rewarding work that they did.
I wanted to do something where I looked after people, and it's just such a rewarding career. So yeah, that's why I chose midwifery.
So here we've got Zoe and Ellie practicing blood pressures. Blood pressure is essential as a midwife. We do a blood pressure at every single appointment. If the blood pressure is too high or too low, it can be an indication that there are complications that need checking out further. So I've been on placement in Barnsley as part of this degree. We tend to stay in the same area for 3 years, although in the 3rd year we do have a couple of weeks at a sister trust just to try somewhere different. The placements so far, I've been out in community, and then this year we're going on to the labour wards, also looking at theatres, neonatal and gynae wards as well. So it's a real varied mix of skills that you'll be learning.
A mixture of antenatal, postnatal and intrapartum. So I've seen pretty much everything so far, which is really, really good.
I really enjoy working with the community team that I'm based with. They've been really supportive. Coming from I've got a childcare background, so I have not got a healthcare background. So they've been really supportive in making sure that I'm confident in my clinical skills and kind of building that knowledge, as well as using the theory from that we get from uni.
So this is Noelle, our simulation model, and we use Noelle to practice obstetric emergencies and procedures that we might see when we're out in practice. Having Noelle is a really good simulation tool because we can practice those procedures in a safe and supportive environment before we are out in the real world. Today we've been practicing a breech delivery and also shoulder dystocia.
We concentrate on the continuity of carer model,
which means that you follow women through pregnancies from antenatal, delivery to postnatal.
And I really liked kind of having the ability to see women from the start of the pregnancy all the way through.
You can build that trusting relationship, and it really does help them through their pregnancy and delivery.
I think the most memorable moment was kind of seeing one of our women through pretty much from the beginning, and then being there at the birth after, and then being able to see her after she'd had baby and see her at home and all settled. So it was really nice to kind of build a relationship with them and see it all the way through.
So here we've got Adele undertaking venipuncture. So this is where we would take blood from a pregnant woman. We test blood for the blood group, the blood levels to check that they are normal, and then anything out of range can be investigated further.
It's really useful clinical skills because you get to practice hands-on rather than just the theory side of things.
They're really helpful, mainly because when you are on birth centre, if you do see an emergency as a student, you do get anxious and you do feel apprehensive about it. But because we're doing the drills and we're lucky that we've got the dolls and the models to use, it helps build that knowledge for when you go out to placement.
Yeah, we are a small cohort here at the University of Sheffield, which is really beneficial because you can work closely together.
The lecturers know you very well. They can see if you're struggling, they'll help you. It's very one-to-one.
It is very rewarding and it is worth it. I'm glad I did it.